Penny Brown famously said, "Hope is not a promise, but hope is a state of mind required by anybody whose life threatened to live their life day by day." So she said, let's open the window of hope, fly out of it, and back into the bright light again.
Before we dive into this week's episode, let's talk about a brand we both genuinely love, Cytoplan. You've probably heard us mention them before, and that's because their supplements are next level.
Yes, Cytoplan has been part of my routine for a while now. They just get it when it comes to health. Their whole approach is rooted in science and totally in tune with nature.
Exactly. Their formulas are bioeffective, which basically means the nutrients are in forms your body actually recognizes and uses properly and at the appropriate levels. Cytoplan is used and trusted by health practitioners across the country. Their formulas are developed by nutritional therapists and backed by over 3 decades of clinical insight. You really can feel the quality when you take them.
Plus, it's not just about what's in the bottle, it's the mission behind it too. Cytoplan is 100% owned by a charitable foundation, which means everything they do is about helping people live well for longer. It's not about trends or quick fixes, it's about real, lasting health.
That is so wonderful to know. And whether it's our energy, perimenopause, menopause itself, sleep, immunity, or just staying on top of your health, they've got you covered. You can also get a free health questionnaire and a consultation by ringing the helpline.
So if you're ready to take ownership of your health, check out Cytoplan, powered by nature, proven by science, and rooted in purpose. We'll pop the link and an exclusive 15% discount code in the show notes. Hello, I'm Caramellas.
Hello there, I'm Dr. Rosy Daniel.
You've just tuned in to Alive and Loving It, and we're here to help you bring joy and energy back to your life. Oh, you're here again. I really do mean it when I say thank you so much for joining us. I know you're giving us an hour of your time, and that must be because it's really speaking to you. So you're very welcome. And this one's going to be a biggie, let me tell you. So this one, Rosie, is about cancer. We're getting straight to it today, aren't we? And the reason why Rosie is an expert on this is because she's been working with people with cancer for 40 years. And you help people find the best of all worlds, fully integrated approach to healthcare, orthodox, complementary, nutritional, self-help, and psycho-spiritual. It must be thousands of people now that you've helped, Rosie, with this.
I think so, Karen, because between, the people I see one-to-one in my clinic, which is several hundred a year, the groups I've taught, the conferences I've spoken at, and through the books that I've written and the Cancer Lifeline kit, I think those ripples have been spreading for a very long time now.
Yeah. And I love the fact that you've shared before that you learn from your patients all the time.
Exactly.
So it's a continuous environment of helping, advising, listening, learning. And I guess that's a key message for me, is that we're learning all the time about this horrible disease.
And I think, what I know about myself is I learn through my ears, not so much my eyes. Obviously there's intuition, but the person who started the centre where I was fortunate enough to learn what I know was Penny Brown, who herself was diagnosed when she was only 39, and she had 3 kids under 10, and she'd fortunately trained as an acupuncturist. And in acupuncture, you don't have a one size fits all, just like in homeopathy, like Marcus was saying to us, you're treating the condition of the person, not the disease. And so for Pen, when she was being told, this is the treatment we do in Western medicine, this is the surgery, this is the chemical bit, this is the radio bit. She kind of ran out of the hospital terrified, because she said, that's completely outside of my frame of reference. For her, 3 people with the same condition might have a completely different causative factor. So, and my goodness, she purely on the basis of female intuition, along with the incredible support of beloved Pat Pilkington, the most loving person I've ever met, who was a natural empowerer on a night when Penny was having a raging fever called Coley's toxins in a center in Bavaria, an immunotherapy center. Penny suddenly said, "It's us, Pat. We've got to change the world." And Pat, instead of saying, there, dear, have a cup of tea, Pat said, oh, okay, Pen, how would it be? What would it look like? What are we going to do? And spent a whole night winkling out of Penny her vision for what became the Bristol Cancer Help Centre. It's over these 40 years, every single bit of that programme that was started on the basis of pure female intuition has been proven by science.
Wow, I know I've heard that story before, Rosie, but that really just touched me then. And it gives it such credibility. I know that people will say that advice has credibility if there's studies and it comes from a very traditional medicine background. And I know you have got that. But actually, I'm just speaking for myself here. What gives advice credibility to me is if it comes from a place where somebody has experienced it themselves.
Yeah.
So
absolutely.
That's what just dropped in for me there, Rosie.
Yeah. And so I don't come from the academic place. I can do academia, I've got science degrees, etc. But what I listen to is the barefoot level of what's working for people. And Penny, when this happened to her, she said, look, if there's a 50% 5-year survival for my cancer, what's the difference between the people who do survive and the people who don't? And she started applying her enormous creative intelligence to thinking it must be that they are running different health behaviors. So she took herself on an odyssey around, most of the world, looking at any center which was looking to improve health, improve immunity, improve tissue response, to uplift the human function. And she completely started from the get-go with this holistic idea that we'll look at everything. We'll look at the body, the mind, the spirit, the environment, all the emotional weight that I'm carrying. So, and she was clearly on the right track, because her original tumor completely resorbed, and she ended up living for 21 years with an illness that had a 50% 5-year survival. So utterly remarkable.
And after all this time, Rosie, of being in service for people who have cancer, you now have evidence time after time after time of people beating their diagnosis maybe, or the length of time that they've been given to live, because they've made these changes. So thank you.
It was that curiosity I've mentioned before, my friend who had irritable bowel, and I watched the way her health was flowing back and forth with her state of mind. So I was already interested in the mind-body connection. And when I got to Bristol, which is now Penny Bron, UK, I saw the spirit matter connection, because Pat's husband, Christopher, was a canon of the Church of England, and he was quite a shy, introverted guy, absolutely gorgeous, honey of a man, but he favored the ministry of healing over the ministry of the word. And any Christian listening will know that Jesus had both. He was a teacher, but what we read over and over and over again in the Bible is that People touched the hem of his skirt and became healed. And, his healing and all the things he did. We can go deeply into that another time. But
I was just going to say, that is another episode. Can think of the title for that one. But let me bring you back
the real healer.
Yeah.
but the place was set up as a healing center. So whatever other modalities we brought into the picture, that beautiful flow of spiritual energy to people that were so deplete, frightened, exhausted, was at the heart of it. And that's why I've always put so much focus on the healing aspect, because it's beyond words. And, you don't have to think about it. You don't have to talk about it. You just have to be able to receive. And these beautiful healers are there. I mean, with the Healing Trust, you can ring up and get yourself on the Healing Trust distant healing list for 6 weeks at a time. And these sweet, sweet people sit around day after day, pouring healing through the airwaves to people who are in need.
Yeah, it's wonderful. It's just such an act of love, Rosy. So we're going to talk about cancer today then, and it might help our listeners to really get to the nitty-gritty of what is cancer? What do we mean about it?
All right. So in our bodies, we have around 200 cell types. So I've got skin cells, hormone cells, bone cells, blood cells, nerve cells, etc. And every single one of them can produce a cancer if the growth of the cell goes out of control. Now, did you ever think, what stops a liver growing when it's liver-shaped? What stops a leg growing when it's leg-shaped? Or an eye growing when it's eye-shaped? It's astounding.
Yeah, why doesn't it keep growing?
Why doesn't it keep growing? So there are, within all of these tissues, which are made up of trillions of cells, there are growth control mechanisms. And what used to be thought with cancer as it all being about the nucleus of the cell, the DNA going wrong, they're now saying that it's that the brain of the cell is in the membranes. So these membranes around the cell that are holding the cell together have got lots and lots and lots of little gates and switches that are switching on and off different aspects of cell functioning and growth control. So yes, DNA damage is a big part of this, the cancer process, but so is cell membrane integrity. Yeah. So you can have, if any cell starts to take off, if the growth mechanisms are lost and the cells start to grow or proliferate, they can create a primary tumor. But then the oddity about cancer is that cells can break away and take up residence in other parts of the body. And these are called metastases. So it's a bit like a strawberry little thingy that sets up in the lettuce bed, a runner from a strawberry. So a cancer can do the same thing. So whilst the primary tumor might be removable or controllable, the problem comes if it spreads and grows and eventually affects the big organs like the liver, the lungs, and so on.
So it's unique in itself, Rosy. I mean, I know there are different types, but I guess it must be unique depending on the individual, and there are so many different ways it can manifest itself. I think that's what I'm hearing.
Well, yes, and it's quite mysterious because say somebody has a lipoma, which is a little tumor of fat cells. It's not every fat cell in the body that's gone wrong. It's a given area, and same with a breast tumor. A lady might have a lump. There aren't 20 lumps. It's not like all the breast tissues lost its growth control. So in the formation of cancer, we have what are called initiators, which are the things that flip that switch, which start that process happening in a very localized area. And then there are other factors called promoters, which accelerate growth.
Right. Okay. And so what are the causes then?
Okay.
of cancer?
So initiators that we all know about: smoking, the tars and the toxins in cigarette smoke can cause a problem mainly in the lungs, but also the throat, the bronchioles, the urinary tract. Alcohol. Other really, really, really big one is nutrition. And, we all hear about this kind of 5 a day vegetables. The average amount of vegetables that adults over 30 are consuming per day is 2.8. And from 18 to 30, it's 1.2. And there are 47% of inner city kids who have zero vegetables at all.
So what I'm hearing there then is that it's the lack of nutrition that is initiating these cells to go wrong, to change. And
is that an initiator or is it a promoter? I mean, initiators are things like, toxins, smoking, chemicals, occupational hazards, radiation, radon gas. And now there's concern coming in about electromagnetic fields. If we're bombarded with 4G, 5G, and multiple systems overlapping, is that another problem that's brewing? But there are also viruses and bacteria which are initiators. So primary liver cancer is caused by hepatitis virus. They've now found that cervical cancer affecting women is also caused by a virus called human papillomavirus. And this is a breakthrough that's happened in the last few years, and why schoolgirls are being offered vaccination against it. And since they have been, the rates of cervical cancer have dropped hugely. And there's talk of the fact that this may be the cause of prostate cancer, and that, that making it a sexually transmitted thing between women and men, and even because of oral sex, throat cancers. So virus, I've been saying since I wrote a book in the 90s about the prevention of cancer, and I put in there, my hunch is that they will find an awful lot of cancer to do with virus. In lymphoma and leukemia, they're known to be, there are certain kinds which are definitely caused by virus, and that knowledge base is growing. And so I send quite a lot of my clients off for viral checks to see what is the body holding, are there problems there, because the body hasn't had quite strong enough immunity to chuck these viruses out.
And so just going back to nutrition, so you're saying that nutrition is not an initiator, but if we have good nutrition and we are nourishing our bodies well, then it has the ability to either contain this or heal these cells that are going rogue. So is that what you're saying? So we keep our nutrition really, packed with a lot of nutrients like vitamins and minerals, because we're helping to keep the vessel well.
Yes, well, it's even more refined than that, because it's been shown that the plant phytonutrients, which are the colorful pigments in plants, so the orange in carrots and the red in beetroot and the green in our green leaves, these phytonutrients can mend broken RNA and DNA in the nucleus of the cell. So just imagine that we get a cell that's compromised through any of these initiators and the cell is damaged. First and foremost, the cell can be repaired through nutrients. It should then have an immune system that an internal intracellular mechanism which switches on a mechanism called apoptosis. And I remember that because it goes pop. So this is called cancer cell suicide, where a cell should self-destruct if it's gone wrong. But then there's immune surveillance. So outside that layer are circulating T cells should spot if there's a tumor cell growing and destroy it, just like it destroys an incoming virus, or the B cells destroy a bacteria. So there are layers and layers of protection in the body, and they can get weakened. Now, if you look at the Cancer Research UK model of what are these causes of cancer, the things I've just mentioned are all on there, but stress is not mentioned at all.
I know. I was going to say, because what was clicking for me is that you're keeping this body well with nutrients, but what if we're in fight or flight the whole time?
Exactly. So when we're stressed, it does a lot of things because it brings down within your T cell population, you have what are called NK cells, natural killer cells, and they are the SAS of the immune system. So they don't go through complicated recognition, is this friend or foe or diddly-da. The minute they spot something is awry, they go in and destroy it. And guess what? People who are naturally feisty and so-called difficult patients have higher levels of natural killer cells. So, when we talk to people about being strong in their own defense, it literally mirrors into the immune system. And it's been found that people are all kind of, oh, don't worry about me, let's look after you. Guess what? Their immune system gets the message, well, you don't matter. And the whole balance in the immune system goes down. So we have less of these natural killer cells, but also when the immune system is affected by stress, it creates a pro-inflammatory, pro-angiogenic environment. So that means that the processes that initiate, because cancer develops in tissues that are lacking oxygen, high in sugar and acidic and full of inflammatory factors.
So that's the perfect environment then
for a cancer just to go boom.
Great.
Okay. And the angiogenesis bit is every tumor has to start a blood supply. So if we have a situation where it's easy for new blood vessels to develop, then the tumor can get hold and create a blood supply.
And when we are in stress, in fight or flight, all of our bodily functions freeze almost. And so the digestion's not working properly and the immune system's not working properly. And if we're stuck in fight or flight, that is a perfect environment for the cancer cells to grow.
Yeah. And I'm going to add on to that. And if we're a passive person who won't stand up for ourselves, that we've also got a less feisty immune system.
Yeah. So we have been speaking in season 3 about the power of no and listening to our intuition, and lots of conversations about how hard it is to say no because we don't want to upset anybody. Now what you're telling us is that no, that feistiness means we have a stronger immune system.
And that's being measured.
It's telling us, we're telling ourselves that we are worthy to be looked after. And so then the body looks after us. Wow.
Yeah. Yeah. And it mirrors right down through. And this is why I'm a mind-body doctor, because, people sometimes think that our frame of mind it's nice to have peace of mind, or it's nice to have a strong, clear vision for our survival and our healing, but it can be the thing that changes, that flicks that switch, that gets your immune system back in control again.
You just said something there, a strong, clear vision for our healing. Now that makes me think about Charlie, who was our guest at the end of season 3. She was talking to her oncologist about why do some people survive and some people don't? And I don't know whether it was a flippant comment that they made, but it really landed with Charlie. She shared it with me, is that he said to her, if people think they're going to survive, they will. And if they think they're going to die, they will. So with that just came in for me when you said, have a strong, clear vision for your health.
Exactly.
And protect yourself in that. Yeah.
And there was a beautiful book written a long time ago now, I think it was 80s or 90s, called Remarkable Recovery. So a woman called Carol Hirschberg and her colleague Mark Orbaum decided to study remarkable recovery. So they looked at what are these people doing, what therapies, what self-help practices, what beliefs do they have, and they compared that with people who were not doing so well. And what they discovered is that every single part of behavior that was positive was revolving around belief. It was people who believed in themselves and their own power to fight and heal the disease, people who believed in their doctors and therapists, people who believed in their supplements and their nutrition they were taking, people who did belief-based practices. So what do I mean by that? Imaging, visualization, affirmation, and then therapies such as hypnotherapy, where people were having their beliefs changed by suggestion. And the study of Professor Leslie Walker, one of my great heroes, who's Professor Emeritus in what he calls behavioral oncology in Hull, Leslie did a study where he gave hypnotherapy to a group of women who were about to have chemotherapy for breast cancer. And they were told that this, I don't think they were allowed to say that the chemo would cure them, but I think they were allowed to say that it would make a massive improvement in their survival. They followed up this group and the control group who didn't have hypnotherapy for 10 years. And at the 10-year point, double the number of women were still alive that had had the hypnotherapy for 6 lots of half an hour only. I mean, you know, there's no chemotherapy, that kind of difference.
Yeah, the data's there. And I remember Charlie sharing with me, she is absolutely adamant, never at one point did I think I was going to die.
Right. Well,
It was in her head.
There we go. There we go. By contrast, I had a lady last week in my clinic saying, thing is, Rosie, I just don't think I can be one of the lucky ones. And I said, okay, stop right there. Stop right there. I'm going to dare you to believe. I'm going to dare you to believe that this can be you. You know, that you can be a person with a remarkable recovery.
Well, you've just joined the dots for us again, love, because that is a lovely thing to say. And I can imagine how in that situation, hearing somebody say that to you is going to be a boost. But now you've taken it to the cellular level, that in your cells, something goes, right, this body is worth fighting for.
Yeah.
So let's get a move on. And all the T cells come out again. And, you know,
exactly.
I mean, it's like a switch, Rosie. If people can make that switch, we're on a different trajectory.
Well, in some of the stories we've heard so far, you know, when Hayley Mills got her diagnosis, she said, right, now the world is going to see what I am made of.
That must have been such an impact on her because she remembers it. I remember Hayley saying, I forget my doctor's name, I forget the treatments and what dates it was, but she remembers that statement.
Exactly.
So it landed in her system, didn't it?
Well, yes, because it was a quickening. It was like, right, now I'm going to show the world what I'm made of, not what my father's made of me or what Disney's made of me or, you know, my beautiful producers and filmmakers. I'm going to show the world what I am made of. And Kit Stapley, when she was told after 7 rounds of chemo, there is no more medicine for you, she came out of that and she said, right, now I need a miracle. I am going to create a miracle. And Gilly Gill, who came to see me, whose story I've mentioned, who's had a complete healing of stage 4 endometrial cancer, her book is called Take Control and Live. And, you know, she also switched. She said it was something I said in the session, which is apparently I said to her, look, your body has mechanisms to heal cancer. All we've got to do is switch them back on again. And I didn't say that on purpose, but she got that and she went out and said, right, we're going to switch those mechanisms back on again. So, you know, and what we have to just quickly say is that this is not then putting people into a state of struggle or striving or, you know, because Penny used to talk about the tyranny of positive thinking. If you think I've got to be positive all the time, it's not that. Because actually a good cry, a good scream, a good laugh, a good rant is as powerful for the immune system. It gives the immune system that kind of boost. So what we're talking about is that it's the deeper, what I call spiritual authority. It's like when something deep inside goes, okay, I'm going to get behind the wheel of this ship. I'm now the driver of this ship. So that's why we talk about from passive healthcare to proactive health creation. It's crossing that bridge into, okay, I'm going to now wake my body up. I'm going to wake up my own power.
Okay, Rosie. So what do you do in a session with your clients?
Okay, so first of all, it's completely personalized because I meet people right across the spectrum, from people who want to have the medical treatment and take the complementary things on the side, to people who want to go 100% natural and avoid conventional medicine if they can. So part of what I have to do is take their history, find out how serious their condition is, what medical treatments they're having, are they getting the best that medicine can offer. Quite often there are things people haven't heard about, like radio frequency ablation for nodules in the lungs and the liver, which can be just amazing. But I'm also feeling my way for people's healthcare values. How do they choose to deal with this? What are their priorities? Because as we've just said, the things people believe in are the things that work. So once I've got a sense of, what this person's red lines are, how they want to deal with it, but also I'm feeling for how anxious are they, how depressed are they, because anxiety and depression really are inhibitors of healing. And so that can be a big priority to have to get that sorted out, if people are going to be well. But then there's a menu of options that I'm putting before people. Top of the list, the nutrition. And there, as I'm not against some fish and some meat that's organic or wild, but it's vegetables, all the way, phytonutrients as juices, as smoothies, stir fries, salads, roasted vegetables. And I put this particular emphasis on getting the body alkaline, because my Indian Ayurvedic teachers have said to me in as few words, Rosy, cancer cannot grow in an alkaline body. Now, this is something that's ignored in Western medicine and not measured, but we can get an approximation of tissue pH by measuring salivary pH. So that's important. We then look at the immune system. Does this person, before we go off nutrition, supplements, I give multivitamins and minerals like CoQ10 multi from Cytoplan. Vitamin D is important in cancer. We need a nice high level of D. But I'm also looking at immune boosters, like their immune support, Cytoplan's immune support. But as I've mentioned already, the other way to get our immunity up is to raise our mood and get us into fighting spirit. Then I'm looking at herbal approaches. My favorites are an Indian herbal concoction called Karktol, but artemisinin or wormwood has come to the fore. Also Essiac and curcumin, but I could see you were going to come in there, Karen.
Yeah, I was just going to say again about the keeping calm, and I can imagine receiving this information and the amount of information from you and the experience of people living through this diagnosis. There's that impact as well, Rosie, because
yes,
it can be quite very disempowering to get a health diagnosis, and it can take your spirit really low. And then again, I can see this empowering option of all the things that you can do for yourself. So it's like you get a diagnosis and you're out of control and you're disempowered. and your spirit goes low. But look at all these that you can do. That's empowering. Take control
You're
back.
so right, because what I should have said is I'm also mapping for, I see this in 3 phases and 12 levels. So the 3 phases are pre-treatment. So between lump appearing, diagnosis, and there being a treatment plan, there's a horrible period of shock and disbelief and grief and maybe anger and people feeling like they're, sometimes people have said, I feel like I'm behind a plate glass wall. There's, I'm just not in the same place as anybody else. I'm so shocked by this. Yeah. And one of my biggies is that people shouldn't receive treatments when they are in shock.
So pause. You advocate a pause in that place.
I absolutely do, because we are supposed to be giving informed consent. And it's been estimated that people retain about 1/8 of what they are told when they are in shock.
Yeah.
So, imagining somebody signing a consent form knows what the hell they're signing. Most people don't even know what they've got, let alone what the treatment's going to do.
Yeah, and there's definitely not enough time to connect inwards, come back into yourself, come back into your power to listen to your own intuition about what you want to happen. And I imagine in that situation when somebody's giving you a diagnosis, if they've got in their head what the treatment should be, it could be, here's the diagnosis and straight into booking appointments. And, you're a long way down the line before you've even reconnected with yourself from the shock.
Well, you're so right. That is the key. And people say it's like they're on an express train, when they've had that. And where that's coming from in the medics. It's them wanting you not to have to wait and wanting to get it moving and being as quick as they can. And there's merit in all of that. But we have to allow people to get themselves back in the room, to be able to see what they're agreeing to. Because, for example, a lot of my clients haven't realized that perhaps chemotherapy might sterilize them and take away their fertility. Now, it's possible to have eggs harvested or sperm harvested and held back for should people get well again and want to go forward with a parenting journey. Mm. But these are big things that sometimes don't even if they're said, they haven't landed. Yeah. So phase 1 is that sort of diagnosis and shock and getting the information. And then we come up to the treatment phase when the biggie is how can we minimize the impact and side effects of treatment and get ourselves strong and peaceful and into the best place. But then there is this what I call the wellness journey that starts, which is, okay, this has happened. Now I'm going to look for the message of this illness, what it's telling me, and how am I going to get myself well again.
And that's all taken from a place of the person coming back to themselves, a level of acceptance and realization. And what you're helping them do, it sounds like, is to be within their power when they're making those choices at a pace that is right for them.
That's the completely ideal situation. And it isn't neat and tidy like that, in phase 1, 2, 3, because the thing that makes all the difference in the world when we are in that phase 1 of the shock and the news is to know that there is a wellness journey, and that there are all these multiple levels of things that people can do for themselves.
Yeah. I've really made that connection of when somebody like yourself tells you, well, first of all, you're an authority, you know what you're talking about, and you'll be suggesting things that they might not have heard from elsewhere. But then you are helping them realize that they can make decisions about their own body and their own wellness journey. So a level of control comes back. All of that brings us back into our power, Rosy. And just being back in our power takes away some of the stress, comes back into rest and digest, which then makes a better environment because the cancer can't grow in a body that is alkaline and calm. And so, yeah.
Yeah, so we phase it, and but knowing that if you're listening and this is happening to you, that you have the power of no, and you have the power to hit pause. And if you are feeling that you're not being listened to, use your hands. Put up one hand, say, honestly, no, that's enough for today. And if somebody persists in saying, oh, but you need this, put up two hands and say, actually, for now, it's a no. I just need time to go away and think about this and process this and find out what is right for me. And, if people still persist, you can say, look, you don't know how you're going to deal with this until it happens to you. This is happening to me. This is my life, my body, and my decision. So please just be patient with me while I really appreciate all of the help and advice you're giving me. But I have to go away and make sense of all of this.
Yeah. And I guess it really helps to have somebody on your side and somebody with you as well when you go for those appointments.
Definitely.
I heard you just say, in that shock state, you're probably taking in 20% of what's being told to you. Mm-hmm.
Yeah.
Okay.
Absolutely. And so once we get to that phase where we're on whether we call it the wellness journey or the secondary prevention journey, which is prevention when we've already got a condition, but all the things we can do to prevent recurrence. We've mentioned food and we've mentioned immunotherapy, but there are the herbal medicines. But as I think we've said in every single episode, the nervous system reset, the calming the body, the getting ourselves out of fear, but working with visualization and imaging. Now, on my clinic website, drrosydaniel.org, if people scroll down the front page, there are 3 sets of audio tracks which are completely free. One called Cope Positively with Cancer Treatment, another one called Images for Healing Cancer, and the third called Heal Yourself, which has got relaxation and meditation and so forth. These visions that you can create, and especially if you have a lovely mentor working with you, to help you create that vision of your healed self. Because in those images for healing cancer, the first one is seeing the cancer gone altogether. The second one is seeing yourself at your most powerful and empowered. Maybe you're like the Statue of Liberty or the Lloyd's Black Horse or whatever is your power totem.
Your feistiest.
At your feistiest. And the third is called healing your timeline. And you may well find these extremely helpful. But as I've said, let's have healing in the picture, homeopathy or acupuncture, and emotional healing of the trauma and the upset. I am very keen on emotional freedom technique because it's so quick and effective. There are many alternatives as well that people want to talk to me about. And there are vogues like repurposed medicines and centers in Europe. But just to draw my threads together, I believe, do you remember that story when you were little about the hare and the tortoise?
Yes.
And guess who won the race? It's the little old tortoise. Well, in my world, the changes that you make step by step with your nutrition, with your stress levels, with finding your joy, with moving to a lifestyle that really turns you on and lifts your soul. This is the little old tortoise going down, just getting brighter, lighter, brighter, lighter, and stronger.
Yeah.
The Fast and Furious stuff, it may put out the fire, but it can be very expensive and harsh on the body. So don't put all your faith in very expensive, way out west things. Get going with your self-help.
Yeah. Consistency, Rosie. Consistency and having somebody by your side who has belief and hope in the times when you can't. because in those times when you can't, you need self-compassion and self-love, but you also need another nervous system, and you need to be able to receive help and guidance. So
Yeah, and a lot of the health creation mentors are now taking my specialist training in health coaching for people with cancer, which is open, by the way, to all health coaches listening. Doing another one shortly in the summer term. But this is opening up a new pathway for coaches who feel drawn, and there are lots of them who want to work specifically with people with cancer. And on my drrosydaniel.org website is a link to the academic paper I wrote last summer, showing so much powerful evidence for the role of health coaching. So really, really get yourself a beautiful coach mentor to walk the path with you.
thank you for sharing all your knowledge, Rosie, and the feeling of hope and empowerment. We shine that brightly through our podcast.
Beautiful.
Great episode, Rosie. Thank you, darling.
Well, Penny Brown famously said, hope is not a promise, but hope is a state of mind required by anybody whose life threatened to live their life day by day. So she said, let's open the window of hope, fly out of it, and back into the bright light again.
And I would add on to that, what I'm taking away is be feisty. You've just given me permission, even more.
Great. Thank you so much, Karen.
Bye.
Thank you so much for joining us on this episode of Alive and Loving It. We really hope that today's conversation has sparked your passion and showed you ways to open up into the vibrant life that's possible for you.
Absolutely, Rosie. I mean, we do have to remember that transformation begins with love, and that is self-love, love for others, and love for our beautiful planet. When you embrace love and you just allow yourself to receive as much as you give, you unlock the fullest potential of your life.
That is the truth, Karen. And we're here to support you every step of the way on your journey. So if you enjoyed what you heard today, please join our community and check out our trainings and our services such as my Dr. Rosy Daniel Clinic and Karen's beautiful women's circles and retreats and the events where we can all go deeper together. And do please send us your feedback. We want to hear your ideas for the podcast, who you'd like us to interview, and the questions you want us to ask and get answered. Through the contact page on our website, just go to aliveandlovingit.org.
I've really enjoyed reading them. But when you're there, be sure to sign up for our newsletter and updates. And what about following us on Instagram as well? We are at Alive and Loving It Community. Once you've signed up to the newsletter, you'll receive extra notes from today's show and more inspiration to help you live your most vibrant life.
Thank you for being with us. Keep shining, stay true to yourself, and remember, this is your time to live your fullest, healthiest life.
So until next time, keep doing what you love most in life. I know Rosie and I will be. We're so excited to connect with you on the next episode of Alive and Loving It. And we welcome you with open hearts to our Alive and Loving It community.